Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Hi, everyone, and welcome to the Dr. R Show. Today, we'll be discussing heart disease in general and the toll it is taking on our society. Heart disease is the leading cause of death in both men and women. About 610,000 people die of heart disease each year, accounting for 1 in 4 deaths. Early recognition and action are important in preventing death and disability, but many people don't know the early signs. Today, we have with us cardiologist Dr. Charles Kramer, one of the original founders of HeartPlace, now an 80-plus group of cardiologists with 20 offices in the DFW area. Dr. Kramer, what is heart disease?
There are multiple different types of heart disease, and there's just no one big answer to that question. You first have to understand that the heart is a very unique type of organ. It's different than our other organs. We think of it is a muscle about the size of your fist if you were to look at it. It's a muscle, but it's a totally different type of muscle. It's not like a skeletal muscle. It has to do so much more work. It's a marathoner. It can't stop. It can't rest. It goes on day, night. And if you were to think of it, if you just tried to, with your own arm, if you tried to, say, curl 5 ounces over and over and over again, well, you could do it maybe for a while. 72 times a minute, maybe. Could you do it for another 2 hours? Could you do it all day, all night? That'd be over 100,000 times in 24 hours, or 37 million in a year. So it's a different type of muscle, but all it demands is a little bit of glucose and some oxygen. And it'll run practically forever if you don't mistreat it. On the other hand, it's a very temperamental employee. If you don't give it its glucose, if you don't give it its oxygen, it doesn't bargain with you. It just stops. It stops working. That's not a good deal. But anyway, if you're talking about different types of heart disease, muscle abnormalities, flabby muscle, hypertrophied muscle, anything that doesn't make that efficient, good squeezing technique can be valvular diseases. You can be born with valvular diseases. You can develop valvular diseases. Everybody's pretty much familiar with rheumatic fever, but multiple different things can affect heart valves. Then you've got electrical abnormalities, different types of electrical abnormalities that mess up your heart rhythm, fast rhythms, slow rhythms. Many people that think they have anxiety attacks, it's actually heart rhythm problems. And that's something that we deal with all the time. And then finally, the thing that, of course, most people are familiar with, and the one most people really want to talk about, usually, is artery blockage, atherosclerotic heart disease, which is the main thing you were alluding to there. 40% of all deaths. It's a big deal.
So now, the heart has different structures, each of which causes a different form of heart disease. You mentioned muscle. So a disease of that, you get what's known as cardiomyopathy.
Right.
You have pipes. Disease of that causes atherosclerotic heart disease. You've got wiring, which causes the conduction abnormalities. And then you've got valves that control how the flow is flowing throughout the hearts. So any one of those things can cause heart disease.
Correct.
And the most common, you mentioned, was atherosclerotic heart disease. What is that? What is atherosclerotic heart disease?
That's artery blockage. That's, as you mentioned, the pipes that feed the blood, feed the nutrients to the heart. And typically it's caused by cholesterol. We think of it as cholesterol in the pipe, but it's by far the most common cause of death in men. It's the most common cause of death in women. It outnumbers all cancer deaths, all of them together. And of course, in women, kills a lot more people than breast cancer does. But it's a very significant problem. I think the cost is supposed to be $300 and something billion a year to the United States alone. But it's a major factor.
And when does one typically begin to develop atherosclerotic heart disease? Is there an age range?
Yeah, in fact, it's very different. And that's one of the differences in trying to diagnose women versus men. Unfortunately, from a lot of the autopsies that we had in Vietnam, it's very prolific, even in 18, 19-year-old men. On the other hand, women are pretty much bulletproof for that first 30 or 40 years. And then it skyrockets. And finally, by age 65, their risk is the same as any man's.
And what is it about women that protects them?
It's the estrogens. At least that's the current thought. It's the estrogens primarily that has that protective effect, which men just don't have, and then the exacerbation perhaps with the androgens from men.
So if that theory is true and estrogens are protective for heart disease, you would surmise that women, when they go through menopause, should really get on some hormones just to prevent the risk of cardiovascular death.
And because all women do that and mitigate through and migrate through that at the same time, it's always difficult to predict where on that scale they're at. Are they just beginning to get in the risk profile, or is their risk profile already maximizing out? And that's hard to predict from any one given individual.
When we return, we'll discuss the treatment and prevention of heart disease with Dr. Kramer. Plus, we'll find out if we are winning or losing the battle with this deadly disease. We'll be right back.
Welcome back to Inside Fitness. I'm Megan and this is Christina, and today we're going to be talking about exercising while you're traveling. Now, nobody wants to try and fit in a workout when they're on the go, but you actually can do it from your own hotel room.
Without any equipment.
Yes, without any equipment, and you can actually do strength exercises and aerobic exercises with your own body weight. All you have to do is alternate between the strength and the aerobic for 30 seconds each.
Exactly. So Megan is going to help us demonstrate some of the strength exercises. So what we're going to do first is push-ups and tricep dips. So go ahead and get down in the push-up position. As you can see, we're going to start in that plank position. The only thing you really need to make sure of is that this body is nice and straight. I don't want to see any slouching or any shoulder shrugs. So let's go ahead and do 3 push-ups. See how she's really engaging her core and just kind of shooting those elbows out to the side. That's perfect. All right, and another one is going to be the tricep dips. Now this is something a little bit new, a little bit different. It's really going to work the back of your arms and your tricep area. Go ahead and get on your heels or flat-footed like this, and go ahead and point your fingers forward and your elbows back. Come up like this, really engage that core, and then we're going to go down for 1, 2, 3. Okay, when we're doing that, we're making sure that our elbows are shooting back, okay? Do that in 3 sets of 10. Now we're going to get our lower body strength training on with the lunges and the squats. Lunges, we've done these plenty of times before. Go ahead and put your foot forward, other foot back, and we're just going to come down at a 90-degree angle for 1. Sometimes I like to put my hands on my hips for 2 and 3. The one thing I want to note here is to make sure that your front knee does not go over your toe, that you're really coming up and down in a nice straight line. Another thing you can do to engage the back of your legs and your glutes is the squats. So feet a little bit wider than shoulder width apart. Go ahead and put your hands here in the middle. We're going to go down for 1 and up. 2 and up. That's really going to engage the back of your legs, guys. Make sure you're doing this in 3 sets of 10, and you're really squeezing when you're going down and squeezing when you're coming up. So now to get a little bit of your aerobics on, we're going to do the burpees. So the burpees is where you go down into a push-up position, kick your feet back, and then come back up. So Megan, let's give it a shot. So see how she's jumping out, and she's jumping back in, and she's coming back up. This is a really great way to help increase your heart rate and get some of that aerobic energy up. So now while she's still down there, we're going to do mountain climbers where she's in the plank position. She's going to run her feet forward, alternating. Perfect. All right, guys, so those are a few things that you can do and really incorporate while you're traveling right from the comfort of your own hotel room. So make sure you're doing that. Make sure you're cooling down. Make sure you're stretching and always staying hydrated. We'll see you right back here next week on Inside Fitness. Hi, welcome back. I'm Christina and this is Megan, and today we are here to talk to you about smoothies. Now, smoothies are an excellent way to get as many fruits and vegetables in your body as you can without eating an entire mountain, because we're going to blend them together. But I, like you, have an extremely busy schedule, so the one thing that I really have a difficult time with creating nice fresh smoothies is the convenience. I don't want to wake up another extra 10 minutes in the morning in addition to all the 1,000 other things I have to do to cut up my fruits and vegetables. So what we can actually do is create pre-made freezer bag smoothies like so, and I'm going to teach you how to do that today. So the two smoothies that we are going to be making are the strawberry banana and then the citrus smoothie. So I've already created the strawberry banana here just so you can kind of see what it's going to look like at the end. Now you'll notice that I put spinach in there, and I know what you're thinking, why in the world would you put spinach with strawberry and banana? But the excellent point about smoothies is that you can blend things, you can sneak things in like greens, especially spinach, and you really won't taste it. Spinach is one of those superfoods that's always readily available, whether you buy organic or just from the store, and it's full of all kinds of vitamins and nutrients.
And it helps promote some heart health, gastrointestinal health, and it's full of iron and antioxidants.
Absolutely. So anytime you can sneak it in, especially if you have kids and you have a difficult time getting them to eat their greens, this is a really great option. So at the end, this is basically what it's going to look like. So for our strawberry banana smoothie, we cut up one whole banana, we did a serving of strawberries, which is about 8 strawberries, and then I just threw in a couple of cups of spinach. So we'll put that in the freezer, and then whenever you're ready, you can grab it and throw it in the blender or whatever you have to mix it together. Today I'm going to actually show you how to just kind of put together the citrus smoothie. So for that, I have mango. And now you can cut up fresh mango and freeze it. That's totally up to you. I like to buy it frozen. I think it's just as good. You can do the same thing with oranges. Once again, never forgetting that spinach. So what I like to do on the bags here, because you can't really put the liquid actually in the bag, otherwise you're just gonna have a block of ice. So make sure that you just write on the outside of the bag whatever type of liquid you wanna use. I suggest using something like almond milk or coconut milk. It just depends on what your preference is or what you're actually mixing it with. So for example, the strawberry banana smoothie, I'd probably go with something creamier like the almond milk, but for the citrus smoothie, I'm probably gonna use the coconut milk. So just to kind of give you an idea, Megan, if you could help me out here. When you take it out, this is actually already frozen. So we took it out of the freezer. We actually went ahead and pre-froze some spinach. So it's just kind of a nice consistency. And this is also gonna make it nice. You don't have to add any ice really if you don't want to. So we're just gonna put some of these in there. There we go, our oranges. Mangoes, let's take a few of those out. All right, and then we don't wanna forget our spinach. And the last and final thing, whatever you decided that you wanted to write on the outside of the bag just to kind of be a little cheat sheet for you, let's go ahead and add the coconut milk to this. There we go. And the great part about smoothies as well is it's totally up to you. I mean, you can put pretty much anything in it that you want.
Okay, ready?
Yep, let's do it. That looks good. That's good. All right. Ooh. So the only way that your kids will know that it has green things in it is that it turns out green, but otherwise it's going to taste nice and citrusy.
Welcome back. We're happy to have cardiologist Dr. Charles Kramer here to continue our discussion about atherosclerotic heart disease. Welcome back, doctor.
Thank you.
How do you diagnose atherosclerotic heart disease?
Well, the first thing you have to do is to risk stratify that patient, that person that's standing in front of you. Obviously, if it's from the statistics, it's much more common if it's a male. You know he's going to probably have some degree of plaquing. It's just a matter of what is the degree. And is that symptom that he's complaining of, have anything to do with the heart? On the other hand, if it's a female, as we were saying earlier, the women are entirely different. They have different symptomatology frequently, not quite the typical type of symptoms, and then you never know where they are on that risk curve unless they're elderly in terms of their prevalence of disease. But anyway, to get to more pointedly to your question, typically we start with some type of stress testing, something that loads the heart, makes the heart work, and that can be anything from just a regular EKG stress testing, stress echocardiography, nuclear stress testing, and then generally if one of those seems to really indicate that, yes, this is something's really going on there, then we're going to proceed on to angiography, much more definitive, where we can tell you exactly, there's the plaque, this is how bad it is, this is the amount, it's a 30% or it's a 70, it's a 100% blockage. Actually narrow it down and be more precise.
So the early tests you mentioned, is that you do those to tell you whether or not you should do an angiogram or not?
Yes.
So you don't have to do all those tests?
Exactly, because you don't want to put, even though the risk is very small from an angiogram, it's invasive. There is risk. Anytime you start poking holes in people, there's risk. And so you don't want to do that just on anybody and everybody that comes by.
So if your stress test is negative, do you then go on to another test?
Again, it depends on that level of symptomatology. And yes, if at that point, well, you thought maybe it was gastrointestinal to begin with, well, maybe they should have some GI tests or lung tests or something else before you start really pushing ahead with more invasive and more dangerous tests.
And if the stress test is positive, do you go right to angiography?
Sometimes that's a matter of degree. How positive is positive? You would think, well, a positive test can be very positive, and whoa, that is bad. And you know, yes, you probably should go on with some type of invasive testing right then. On the other hand, if it's just mildly positive, he had good exercise tolerance on that test, he has good functionality, and yet he did show some problem, well, maybe it's much better to try medication first, diet correction, nutrition, exercise, different types of preventative, protective medicine before proceeding on to other tests.
Okay, so say you've diagnosed that somebody has a positive stress test, you suspect atherosclerotic heart disease, you prove it, how do you treat it?
Well, there's a lot of different modalities, but most of the time you're telling the patient to do what he already knows he should be doing. We all should be moving around a lot more. We're made to move and to be active. We all should have much better nutrition. We should be doing that. And the majority of patients that walk into your office, they know that. They're just not quite doing it, and they haven't been doing it. Sometimes it does come down to just bad genes. And I jokingly sometimes tell my patients, well, maybe one of the main things you should have done is choose better parents next time. And obviously they can't do that, but sometimes people we have that genetic predisposition that there's not a whole much we can do about it, even though we try. You can try all the diet, unless you're willing to go to an extreme diet, it's going to maybe improve your ratios 15% or so. Then you're left with medication. And you can try the exercise program. That certainly helps too. You should be doing it. But it's still very difficult to make big-time progress. Frequently it comes down to medication.
What medication do you typically use in patients with atherosclerosis?
There's a whole gauntlet of type of medications that American College of Cardiology and have basic recommendations that we utilize and different classifications of different medications. And as I sometimes tell my patients, kind of where we're at in medicine nowadays, and that's not just cardiology, it's endocrine or almost multiple different medical problems. We don't cure much of anything. We just, maybe one day we will, maybe the next generation, that's what we'll do. But right now, we manage things. And we can manage the heck out of a lot of things. We can keep people going for many years. Life expectancy is 20 and 30 years beyond what I can remember just when I was in training. You would see somebody in maybe 3 or 4 years, and you'd know that they were going to have their second bypass. You knew that they had a life expectancy maybe of 5 years or something. Not anymore. You may be talking 20 or 30 years while you manage their type of progression. We use beta blockers, we use nitrates, with the classification calcium blockers, ACE drugs. All of these don't mean much to the average person, but all these are different categories in addition to anticoagulation just to prevent clots itself, like aspirin, Plavix, and all the newer types of Plavix that are on the market nowadays. So every few years you get a new class of medications that come out that can increase and improve the prognosis of somebody that's diagnosed with heart disease.
So now, are we winning or losing the war?
We're not curing anything. On the other hand, frequently we can get it to a tie, to where we can manage it and hold it where it's at, keep it from progressing, keep that person moderately happy, functional, active guy. But does it go away? Only rarely, when we can really get those cholesterol levels rock bottom low, and sometimes that's possible.
Thank you, Dr. Kramer, for joining us. And thank you, everyone, for watching. As Dr. Kramer explained, it is up to each of us to take appropriate steps to prevent heart disease and its many repercussions. Be aware of your body and what it is telling you. Until next time, healthy living and goodbye.